Welcome back. You're still watching Health Domain, and we still have our doctor here, the beautiful Dr. Vivian. So you're looking so beautiful. I've been admiring you since morning. And your skin is so wonderful.
Well, I try to practice what I preach.
Yeah, so talking about hyperpigmentation, bleaching, do you bleach?
Bleaching is still contribution. Do I bleach?
Yes.
Oh, no, I don't. I've never bleached. I've never even tried to lighten my skin.
Is it as bad as people say it, or do you? Personally.
Think about bleaching, right? There are pros and cons. I think I mentioned before that we use bleaching to address concerns like hyperpigmentation, therapeutic bleaching. But then now you uniformly bleaching your skin. There are many reasons why people want to bleach. Maybe they have an uneven skin tone, or they have conditions such as vitiligo, where sometimes by destroying the pigment that exists, you're able to get the uniform complexion. So that's a therapeutic form of bleaching as opposed to the cosmetic bleaching, which, as a matter of fact, Nigeria has the highest percentage of women that bleach and a very high percentage of men as well, worldwide. Worldwide, Nigeria is known for that. But the unfortunate thing is that a lot of people use very dangerous chemicals to bleach.
So it's very bad.
That's where the problem lies.
Okay.
And then also the reasons for bleaching. We don't know what it is. Is it? We say sometimes it's about colorism, and you know what colorism is? It is when people within the same race discriminate against the darker skin-toned individuals, and that is what I think is responsible for bleaching. But some people say, oh, maybe it's because of racism, where they want to look like Caucasians.
Yes.
But I think it's more about colorism.
And people think they're actually more beautiful when they bleach.
When they're lighter skin. Because they attract, the truth is, because we're a dark skin race, if you are light-skinned, you will attract more attention because you stand out to the crowd. There's no doubt about that. But what measures are you going to take? How far do you want to go? Do you want to kill yourself?
What about people that are not bleaching? They said they are not bleaching, they are toning. What is the difference?
Okay, what people call toning is that it's not as extreme as trying to become white per se, but just maybe a few shades lighter. That's what I think people mean. But the mechanism of action is the same. The same enzyme that produces your skin color is inhibited by mild products as well as the very strong products.
Coming to the product, a lot of people use different things to bleach. The topical skincare and also injectable tablets, injections.
Topically, very common is this use of steroids. And steroids are anti-inflammatories, but the side effect, of course, is that they inhibit the enzyme, and some of them actually destroy the pigment-producing cells. So you're actually damaging your skin. Now, the downside for most products is that products are absorbed into the bloodstream from your skin. Many people don't know this. So I don't think anybody would bleach thinking that it's going to kill them. But then that's a possibility if you use harmful products that are absorbed through the bloodstream and depositing your vital organs like the kidney, the liver, the bone marrow, and will eventually lead to kidney failure and ultimately your death. I have a patient who called me of recent. She and her sister have been bleaching for more than 30 years and their kidneys are failing, the two of them. So this is a real problem. And if you lose pigment as well, you're more prone to sun damage. Sun damage will eventually lead to skin cancer. It's a possibility. So if you're somebody who bleaches and you don't use sun protection, which many of them don't because they go out and they fry. They even say, oh, my skin is burning when I go out in the sun.
And I think after a while, they don't even look good.
No, they don't. Because you're damaging the skin. The structural integrity of the skin is compromised. So in that situation, you lose the firmness, and then the supportive structures are destroyed. Who wants to have stretch marks from head to toe? That's something we see. And then you see stretch marks from head to toe are commonly seen. The skin gets really thin. You can see the blood vessels showing in some of the women. And if they require surgery, wounds will not heal in individuals like this.
Going to the causes of bleaching, I think as a doctor, do you think it's also psychological? Not just about the...
There's a psychological factor involved. Maybe an inferiority complex, or attention seeking. I really don't.
Is there a way to prevent that? Is there like you have to go on social media and keep telling people you look beautiful, you can take care of your wonderful skin?
The thing is that if you have an identity crisis, or if you're demoralized and lack self-love, you should see a therapist. Do you understand? A psychiatrist can help you. I know when people are afraid of seeing therapists in this country,
it's not as bad.
They feel it's stigmatized, but it's something that is a stigma. But there's a condition called body dysmorphic disorder. Yeah. You've heard about that, where your mind tells you you're so ugly, even if you're not. So when you have conditions like this, I say practitioners should not capitalize on people's insecurities, because people can go to a doctor who might just decide, you know what, he wants this treatment, I'm going to give it to you. But if there's a deep-seated problem, that should be addressed first.
Okay. Can you give us tips and advice on how to have a very wonderful skin and to reduce hyperpigmentation?
I always say the best skincare starts from within. Okay, so what you eat, what you drink, how much sleep you get, exercise as well, all are factors that influence your skin. So it's not about just piling on products. Skincare goes beyond that. Then of course you have to get the products that are right for your skin type, and then use the products regularly, twice a day. I know a lot of people don't like the night care, but you know what? Night care is more important than daytime care. Excuse me. Because at night, the body works in exponents to deal with the stresses of the day, to deal with the environmental pollution. So products work better at night. And if we're actually treating people for conditions, it's the night care that is more important, because we get better results.
We're still talking about hyperpigmentation. Don't go anywhere. We'll be right back. Okay, it's time to debunk some medical myths about skincare. So the first one goes like this. Once treated, it's gone forever.
You know what? Whatever caused it in the first place, if that repeats itself, you'll definitely have the pigmentation again.
Okay, so that's a myth. Or laser treatment for hyperpigmentation will work, because a lot of people find it very difficult to cure acne and hyperpigmentation, and they feel, if I go for a laser treatment, I'll be fine.
It's still not enough, because first of all, for acne, there are many different factors that influence development of acne. So if you don't address all of those, you can keep treating and it will keep coming back.
Okay, so laser treatment is not the gold standard for...
No, definitely not.
Okay.
It's very expensive. We have skin transformation packages for dealing with acne, and then also lifestyle choices and information as part of our packages. These are things also... There's a very good article I have on my website. It's called Acne. Not all breakouts are created equally. So it goes in depth into different causes.
What's the name of your website for our viewers?
drviv.com. So that's doctor spelled in full, then viv.com. Yes.
Okay. Is hyperpigmentation genetic?
I wouldn't say it's genetic. It's some people are born with darker patches. If you've in that situation, you see children born with moles or pigment that covers even like half of the face. So that is something that they're born with. But being prone to hyperpigmentation as a result of the assault or injury or exposure to the sun.
Okay, also another thing is black don't crack. black skin don't need sunscreen.
No, black skin needs sunscreen, so that's a myth for sure. But the fact that black don't crack, I agree with that, especially if the darker you are, the less prone you are to sun damage. And sun exposure is probably the leading cause of aging. So if you're able to protect your skin, well, of course, because we have melanin. The melanin activity in the black race is more active than in lighter skinned individuals, like the Caucasian race. But we all have the same number of melanin producing cells. Because of our activity, it's created to protect us more from the sun. And that is why we don't age as fast as Caucasians, for instance. That explains it.
And we don't need more sunscreen like them.
You need sunscreen. Nobody should try to avoid that because that's the question I get all the time.
So,
Like, Jack, I think it's
actually, a lot of people don't use sunscreen.
They don't, but we should encourage them.
Yes.
Because of the protective benefits. We're thinking about the premature aging as well as development of skin cancer, which could be deadly.
Okay. Another myth is that while treating dark spots, you can't do it without bleaching.
Well, as I said, you could use exfoliation techniques like a chemical peel or scrubbing. If the surface, if the pigmentation is surface, then it could help to fade it gradually over time. But you could use agents to bleach them away if you want more rapid results.
Okay.
And if it's deep.
Thank you. Another myth is that you only need sunscreen when you're going under the sun. If you are going to be indoors throughout the day, you don't need sunscreen.
You need sunscreen all the time, every day. And you should also know that sunscreen only lasts you 2 hours. So you only have 2 hours of protection. So in an ideal world, you would reapply. And when we're talking about sunscreen, it's not just to the face. Any part of the body that's exposed. So if you're wearing short sleeves, you have to wear the sunscreen on any skin that's exposed, even on your legs.
Talking about hours of sunscreen, you said it's only effective for 2 hours. What if you're using your makeup?
That's a good question. Now the good thing is that there's sunscreens created in translucent powder form. So you can now dust that on over your makeup.
So that's a very good way of protecting yourself from the sun.
Yes, well, at least some good protection.
Thank you so much, Dr. Vivian. I hope you've learned a lot today.
A video on hyperpigmentation by Taiwo Falana. Let's talk about hyperpigmentation, the dark patches or spots that just seem to pop up out of nowhere and refuse to leave. You know, those stubborn marks from old acne, burns, or even hormonal changes like during pregnancy. If you've ever wondered why they're there and how to get rid of them, you're in the right place. Hyperpigmentation basically means your skin's making too much melanin in certain spots, making them look darker. Now, while anyone can get it if you have darker skin, like Black, Hispanic, or Asian backgrounds, you're more likely to see those marks linger, and even get worse if not treated right. And no, it's not just from your genes though. Some people are born with things like moles. Most cases, it's about what happens to your skin after things like pimples, scrapes, or burns. Here's where many of us go wrong, picking at spots, not wearing sunscreen, or using harsh products hoping to bleach the problem away. Trust me, quick fixes like unregulated bleaching creams or steroid ointments can actually make things much worse. Think thinning skin, stretch marks, or even organ damage. Scary, right? So what actually works? First, see a dermatologist. Don't DIY your treatments. Gentle exfoliation, maybe 2 to 3 times a week, can help fade surface spots. There are topical treatments like hydroquinone, but honestly these need to be used with real caution and proper medical advice because overuse can lead to some really nasty side effects. And laser treatments? They're not a cure-all, and if done wrong, they can actually darken your skin even more. Now, let's bust some common myths. Myth 1. Once you treat hyperpigmentation, it's gone forever. Not true. If you don't tackle the triggers like picking your skin or skipping sun protection, it'll come right back. Myth 2. Black skin doesn't need sunscreen. Also false. Every skin tone needs sun protection, every day, even indoors or when it's cloudy. So what's the best way to keep your skin glowing? It starts from within. Eat well, stay hydrated, get good sleep and exercise. Use products that match your skin type, moisturize daily, and always use sunscreen, at least SPF 30, but higher if you burn easily. And don't forget, reapply every 2 hours and use it on all exposed skin, not just your face. Finally, remember, hyperpigmentation is common and you're not alone. Don't let social pressure or colorism push you into unsafe treatments. Focus on your overall skin health, consult professionals, and stay informed. If you found this helpful, hit subscribe for more health tips, follow Dr. Vivian Oputa and Dr. Sunday on Instagram, and check out daraviv.com for more resources.